Hello, I'm Zach Moser, and I'm presenting today on a risk assessment for opioid use and overdose in West Virginia. To start out for this presentation, I'll provide an outline of where we're going to be going today in our discussion. We'll start out with an overview of opioid use disorder and overdoses in West Virginia. We'll talk about the social determinants of health that affect that disorder, the risk factors, protective factors, what can we do about it, and some summary conclusions. So first we'll talk about the overview of the opioid use disorder in West Virginia. West Virginia is in the heart of Appalachia. It's mostly rural. It's mountainous terrain, difficult terrain. This population can be very isolated. There are about 1.7 million people that live in West Virginia, according to the U.S. Census Bureau, but there were 1,262 opioid-related deaths in 2021, according to the West Virginia Bureau of Public Health. So quite a lot of people die from opioid overdoses in West Virginia, and it's widely considered to be kind of the heart of the opioid epidemic in the United States, along with Kentucky and parts of Missouri as well. So this area I consider to be very similar to my home region of the Ozarks. So my area has some of the same issues. Median income is $55,000 a year, which is less than the U.S. average. So this is also considered an impoverished area. Importantly, too, a trend that has popped up over recent years, not just in West Virginia, but including West Virginia, is that in 2017, 47% of opioid-related deaths were caused by fentanyl, and in 2021 and beyond, that is up to 91% now. So for social determinants of health related to opioid use in West Virginia, there are some that are specific to West Virginia, and that's the injury-prone employment. So West Virginia is famous for being a coal mining and mining area. People get injured in those jobs more prevalently, and then they end up needing to take pain medications, and so they start their journey on opioids, which then becomes a potential risk factor and difficult for them to get off of them in the long run. In addition to that, they have just insufficient access to health services in general, which worsens those problems. I mentioned the high rate of poverty, which is a risk factor as well for opioid use disorder. So many things working against them there. The risk factors for opioid use or opioid overdose in general, according to the CDC, include the history of overdose in general, or substance use disorder, sleep apnea, which makes sense because opioids affect our breathing, so if you already have a problem with that, opioids are going to make that worse. Taking high doses of opioids, the more that you take, the worse the problem can be, and the more likely you are to overdose. But especially if you're taking that in combination with other medications or other street drugs, benzodiazepines in particular. Also something that you see as well is taking high doses after losing tolerance. So if someone spends some time in jail or something like that and they don't have access, and then they get back out and they take a dose that they were used to taking, they can overdose. So protective factors. One of the biggest ones is access to naloxone, which is the reversal agent, but a safe supply as well is important. So getting those medications that can prevent them from withdrawing while still being a lower risk of overdose themselves. So like Suboxone, which is a partial opioid agonist. Increasing income, that makes it less likely for people to struggle and be on opioids. Access to internet has been shown, access to healthcare in general, many things that you wouldn't necessarily expect can be protective. So what can we do? We can provide access to the things that we talked about: naloxone, substance use disorder treatment, access to the internet, increase the income of residents. You could do a form of universal basic income. All those things would be protective. And then on the other side, you can decrease risk factors like you can have pharmacists or physicians screen for opioid and benzodiazepine combinations, which would, avoiding those combinations would be helpful, making sure that people are treated for sleep apnea, and provide regulated dosages that are less likely to cause overdose, like Suboxone, especially to individuals coming out of jail or treatment facilities. For conclusions, West Virginia is one of the states suffering the most from the opioid epidemic, especially their history with coal mining and injury-prone employment. It's been a particular issue there, made worse by the pharmaceutical companies and their marketing in the area. There are many interventions such as naloxone, substance use disorder treatment, and improving economic conditions that will reduce the disease burden. And then these are the sources that I referenced throughout the slide. And if there are any questions, you can let me know. Thank you.